In this last little part, I'm going to talk about the just the common characteristics and differences in motor tract lesions. So there are several common signs of motor tract lesions, including paresis and or paralysis, abnormal timing of muscle activity, Babinski's sign, and myoplastic changes in muscles, meaning contractures and that sort of thing. So the ones that most commonly occur with chronic spinal cord injury are hyperreflexia of the phasic muscle stretch reflex, clonus, abnormal withdrawal reflexes, and clasp knife phenomenon. With lower motor neuron, you often get hyporeflexia, you get Babinski's sign, paresis and paralysis, and myoplastic changes. So I am going to talk about one pathology that is in this chapter, and that's amyotropic lateral sclerosis. It used to be known as Lou Gehrig's disease. It is a disease that destroys only motor neurons and motor tracts. So the destruction of the motor neurons and motor tracts is bilateral, resulting in both motor tract and motor neuron signs. So the motor tract signs, which is upper motor neuron, includes paresis, hyperreflexia, Babinski's sign, atrophy, and fasciculations. The motor neuron signs, so lower motor neurons, include paresis, hyporeflexia, myoplastic changes, hypotonia, atrophy, and fibrillations. So loss of motor neurons in cranial nerves causes difficulty with eating and swallowing, speaking, and head movements. So nearly 50% of all people with ALS experience emotional lability, which is pathologic laughter or crying, uncontrollable laughter or crying. So approximately 90% of ALS cases are idiopathic. Although the gene responsible for the familial type has been identified, that's only 10% of cases. In ALS, the astrocytes fail to clean up excessive glutamate, causing excitotoxicity, and so we lose neurons. Recent research indicates that brief exercise of low to moderate intensity is beneficial for muscles that are not profoundly weak. Most people with ALS die of respiratory failure due to destruction of the phrenic nerve, which innervates our diaphragm. So it's a devastating disease with a terrible prognosis. The average lifespan after diagnosis is 3 years. There are some rare types, like the type that Stephen Hawking had, where you can live greater than 20 years, and death usually occurs from respiratory complications.